I'm Dr. Wang from Kaohsiung, Taiwan. I have nothing to disclose. Last year in Florence, we demonstrated the effect of low-energy shockwave on capsaicin-induced prostatitis. It can decrease the pain behavior and also the expression of inflammatory molecules such as COX-2 and NGF. However, as we know, the inflammation in bladder or the prostate can induce the hyperexcitability of the afferent fiber through the dorsal root ganglion and the spinal cord to the brain. So we hypothesize that the low-energy shock wave on prostate can attenuate the central centralization in spinal cord level, also reduce the neuron activity of the pain in brain. So we do the same experiments. We inject the capsaicin into the prostate, and at the same time, and 24 hours after injection, we apply the shockwave direct onto the prostate at the level of 0.12 millijoule. On day 3, we harvest the L6 dorsal root ganglion and the spinal cord. We can find the COX-2, NGF, and BDNF positive cell expressed in the dorsal root ganglion after the capsaicin injection. Also, the shockwave can decrease these positive cells. And we can see the expression of COX-2, TRPV1, and neurotrophins such as the NGF, BDNF, and the neurotrophin receptor TRKA expression on the dorsal root ganglion after the capsaicin injection. The shockwave can reduce this expression in a dose-dependent fashion. That means 200 and 300 shots really decrease the expression. We can find a similar result in the dorsal horn of L6 spinal cord. What happened in the brain? If we can lower the expression of neurotrophin in spinal, then the pain will decrease in the brain. So we use the functional MRI, use the bold response to evaluate the pain behavior. After pre-injection of the capsaicin, we can find there's no signal of pain. And one day after the injection, we can find some the yellow signal in the brain. And after 3 days, this signal became stronger. Even we can find it in the cortex. And in the shockwave group, we can find this signal significantly decreased after the treatment. That means low energy shockwave could possibly attenuate the central centralization, which reflected by the reduction of NGF and the related neurotrophin expression in the spinal level, and also the MRI signal at the thalamus and the dorsal root ganglion was decreased, attenuated. So this finding suggests that low energy shockwave could have the potential clinical benefits for the treatment of chronic pain or even the cross-organ centralization in the future. Thank you.
Nice demonstration of central sensitization and subsequent downregulation. Questions?
I just had a very quick question. Do your animals jump off the table when you give them capsaicin? I mean, that 10 millimolars, orders of magnitudes more than what people typically give.
Okay, this model is, I think it's not quite similar to the chronic one. But after the injection, not like the jump on the table or something, they became very silent and have the pain gesture. Yeah, you can see they don't want to move at all. Yeah, you touch him. Yeah. So we can test the pain in the awake fashion. Yeah.
Matthias Walter from Vancouver, Canada. Just one question. You induce an acute pain with one single shot of capsaicin, and you suggest that your finding can benefit on chronic pelvic pain syndrome. Can you elaborate on that?
Yeah, that's the problem is, as I say, is the model is not the good model for chronic pain. But we can see the effect of the shockwave on these kinds of inflammatory cytokines or the change in the neurotrophins. That probably we are now working on a more chronic model of the chronic prostatitis to figure out if it also works on the rats. Also, we are now trying to do some the functional MRI in humans to see if it really works. Yeah.
Thank you very much.
Thank you.